Distinguished ladies and gentlemen of the press, I want to once again welcome you to the National Strategic Cold Store of the National Primary Healthcare Development Agency, which is an agency under the Federal Ministry of Health. As you earlier observed, we do have up to 3 ultra cold chain equipment that are fully functional in good working condition. These ultra cold chain equipment each have a capacity of 700 liters. So total capacity available to store the Pfizer-BioNTech vaccine is 2,100 liters. For the first 100,000 doses of the Pfizer vaccine that we're going to be receiving by the end of this month or early February, the total requirement is 500 liters. So we have more than required capacity. So some of the information going out there that we do not have the capacity to store the 100,000 doses is not correct. So today's visit is really to demonstrate the availability of the ultra cold chain equipment and to emphasize the fact that we're working together with our development partners to roll out a comprehensive deployment plan that will ensure that we leverage on the experiences of the polio eradication program, all of the really amazing work that Nigerians have done, the frontline health workers that helped us to get Nigeria and Africa certified as wild polio virus free just last year. All of that effort will be tapped into towards the deployment of COVID-19 vaccine. We understand and acknowledge that it's not exactly the same vaccine, different scenarios, but the same types of principles around coordination, micro-planning, trainings, building capacity, community engagement. Those are the same principles that will help us be successful. Only last year, we had, in October actually of last year, we had a campaign that reached 23 million kids under 5 years of age. So that gives us confidence that we'll be able to reach Nigerians over the course of the next 2 years, up to 70% of Nigerians. However, we are mindful that this has to be predicated on real-time issues. For example, the vaccines are not even here yet, so you cannot start the countdown until we have the vaccines. The first tranche of vaccines will be coming by the end of January or early February, right? 100,000 doses is just a drop in the ocean. It's not anywhere near what we require, right? So the clock starts ticking when we have those quantities of vaccines that we can actually begin to make a huge dent in terms of coverage of Nigerians. We're also mindful that we still have to do a lot of work to overcome the vaccine hesitancy that we're already seeing, the misinformation, the conspiracy theories around the COVID-19 vaccines. And we do not take for granted that all Nigerians understand the principles around vaccine production. That is why we know we have to do the hard work. It's not enough for us to offer the vaccines to Nigerians. We also have to do the hard work of sharing information, educating Nigerians about the vaccines, how it is, they understand how to communicate. Our religious leaders, our community-based organizations, opinion leaders, political leaders, because they are the representatives of the people and they can communicate even better than ourselves, right, around how safe the vaccines are and what we have done to make sure that all the boxes are checked when it comes to making sure that Nigerians have access to these vaccines.